To better prevent and control COVID-19 and reduce the risk of cross-infection among patients in hospitals, many hospitals and medical institutions in China have opened online diagnosis and medical consultation platforms to provide free online medical help. According to the Baidu Health Big Data report, searches for common symptoms of depression are among the most popular searches about COVID-19. As such, offering psychological assistance for people in need is extremely important during this difficult time.
几乎所有的咨询者，他们都害怕自己或者家人被感染，这是最大的一个，可以说是最大的一个问题，最担心的。
Baidu Health's online medical consultation platform, Ask a Doctor, provides online self-rating scales commonly used in psychiatry, such as sleeping screening questionnaires and self-rating scales for anxiety and depression. These questionnaires not only allow people to become more aware of their psychological and emotional problems before they get worse, but also help doctors with pre-diagnosis. Online medical platforms recommend psychological counselors to patients for their follow-up treatment based on the results of the self-rating reports. According to Dr. Gao, many people may have developed emotional issues as a result of long-term home isolation. The three major emotions that have come up in online consulting are anxiety, depression, and discontent. How should we cope when we have these feelings?
首先呢，我觉得要让所有的这个用户和来访者要了解，这样一些情绪是短暂的，而且呢也都是正常的应激反应，每个人都有可能出现，或多或少，也许只是程度上的差别吧。首先我们要知道要做好一般性的应对，就是做好个人的防护，鼓励适当的运动。第三就是我们要学会一点点放松家里面学一点点简单的呼吸放松，也可以做一些冥想，舒缓自己的焦虑情绪。第五就是我们要鼓励跟家人一起来沟通交流，改善我们之间彼此的这种家庭关系。
As more and more people's lives begin to return to normality, lots of office workers have been dealing with the anxiety about being infected due to their newly increased amount of contact with other people. As one such person, I'm also afraid of touching things in public and being in close proximity to other people.
我是可以理解这种状态，一定要科学的来了解这个新冠病毒它是怎么传播的，让自己的心理上有一种公共卫生的理念。这个肺炎要继续传播下去，必须要经过传播途径，就是我们讲的呼吸道的，人与人说话的时候，近距离说话的时候，呼吸道的飞沫的传播。理念里面包括切断传染源和传染途径，那我们就要正确的戴口罩。一个口罩它有3层外面这一层是阻挡这个外来的一些飞沫的，最里面的那一层是阻挡我们自己的这个呼出来的空气。如果面对面的来的人呢，他也是戴了口罩的话，那你们之间就有双重的防护。这个双重防护的话，就极大的这个增加了你们的安全感。你可以戴着口罩说话没有关系，别人也会对你呢增加一种相互的一种互信感。
中国各地就是目前很多中小学已经开始开学了，那么就是儿童青少年这一块，他们这个群体有在线上向您寻求过帮助吗？
有的，他们面临这个升学的压力然后呢因为疫情的关系呢，一直也没有能够及时的回学校去备考，所以他显得非常焦虑睡眠也不好在家里面的话呢，因为长期的跟父母在一块儿，他可能亲子关系也受到了影响有的孩子甚至于就是完全不在状态他就沉迷于这个游戏他即使开学了呢，他也回不到那个集体的这个学习当中去我觉得这样一些情况呢，在高3和初3的学生当中比较常见。很多孩子的一些焦虑吧，它是来源于家长的。那家长紧张呢，他也紧张。那家长防护过当的话呢，那小孩子也防护过当。希望家长能够充分的了解这个当下疫情的一些动态教这个孩子们不用过度的紧张，尽量的放松心情去学习尽量的遵守这个在疫情下的非常多的一些基本的规则那么家长呢也是自己要身先士卒去做到。对于家长来讲，还要讲的更多的一句话就是 通过这一次疫情，我们要认识到这个人的生命的重要性。对。那么要了解到学习呢也许不是这个孩子是最重要的，可能身心的健康是最重要的。对。那么在这个身心非常健康的情况下，发挥自己的余力，再去学习，再去认真的学习，这才是最棒的。
Online medical platforms pull doctors from around the country to serve patients free of charge 24 hours a day. This kind of interaction plays a very important role, letting patients be heard as well as offering them support through text message, voice call, and FaceTime. Although we may well need to maintain social distancing and continue to use online communication for the foreseeable future, it is undeniable that this public health emergency helped bring about a better understanding of public health and social responsibility.